Hello everyone, we're going to continue Vitals Part 3 with blood pressure. Blood pressure is abbreviated BP. It is the measurement of the pressure that the blood exerts on the walls of the artery during the contraction and relaxation phases of the heart. Blood pressure is measured in millimeters of mercury with a sphygmomanometer, which you know as a blood pressure cuff. The systolic pressure, which is the top number, is when the left ventricle is contracting, and a diastolic pressure at the bottom number when the left ventricle is at rest. And I'll show you in just a moment how a blood pressure is written. So a blood pressure is written in the form of a fraction. So a normal blood pressure is 120/80. So how do we write it? The top number, as I stated before, is the systolic pressure. So that's going to be the higher number. It's going to be on the top. The bottom number is going to be the lower number, which is the diastolic pressure. So again, a blood pressure is written in the form of a fraction. High number on the top, low number on the bottom. Systolic over diastolic. The pulse pressure. This is the difference between the systolic and diastolic pressure. The pulse pressure is an indicator of health and tone of the arterial wall. Do you have a strong arterial wall, or do you have a weak one? That could potentially lead to stroke or heart attack. Now, the values of the pulse pressure can be found in the chapter that I will post as a reference point. It will be found on page 372 of the chapter. So these are the blood pressure types. You have hypertension, which is called high blood pressure, or that's what you know it as, is high blood pressure. The medical abbreviation for hypertension is HTN, capital HTN. So if you see that, know that it means blood pressure. The pressures are greater than 140 millimeters of mercury systolic and greater than 90 millimeters of mercury diastolic. So it's 140/90. That's considered high blood pressure. Hypertension is low blood pressure. Its pressure is lower than 100 millimeters of systolic and lower than 60 millimeters of mercury diastolic. So 100/60, that person has a low blood pressure. Now, is a low blood pressure bad? No, not necessarily. My blood pressure, well, I take that. Some people do have a blood pressure at 96/60 or 99/60. Some people do have that, but you have to know that that's their normal and that they've been actually cleared or treated for whatever reason why their blood pressure is low. Orthostatic is postural hypertension. It occurs when there's a sudden drop in both the systolic and diastolic pressure when an individual moves from lying down to sitting to standing. So if you get up too fast, some people say, oh, I'm dizzy or I have a headache. It's because that's orthostatic hypertension. So factors that influence blood pressure. You may have an increased blood pressure with excitement, anxiety, nervous tension, stimulus drug, exercise, and eating. What does this sound similar to? They have increased factors, and they almost mimic the same. Because essentially it is the same. Your pulse typically mimics your blood pressure. So if you have a high blood pressure, your pulse is more likely going to be high as well, because you are counting the beats of the heart. Whereas the blood pressure is calculating the pressure in the heart. But the pulse also has these same influences. When we talk about a decreased blood pressure, we're talking about sleep or rest, a depressant drug, shock, excessive loss of blood, fasting due to not eating. Now, I always mention a depressant drug, especially weed, because that's something prevalent amongst this age group. And it's very important that if someone is partaking in this particular event, that they need to be careful. I had a student that was with another student doing some things they had no business, especially with some illegal drugs, and her friend could have died because she was barely breathing. So if you know that something isn't normal, please get help. Please get help. Factors, factors that influence blood pressure. These factors may cause a change in the readings. So if the patient is lying down, if the patient is sitting, or if the patient is standing. It is very rare that you are going to have a patient stand up to take a blood pressure, but it is something we still teach because some institutions, meaning hospitals, require that it's done, but not very many. This blood pressure chart will be on your exam, so you will need to know the difference between each stage of blood pressure. So normal is less than 120 and less than 80. Pre-hypertension is 120 to 139 and 80 to 89. High blood pressure, hypertension stage 1 is 140 to 159, 90 to 99. High blood pressure stages 2 is 160 or higher. Diastolic is 100 or higher. A hypertensive crisis, which is an emergency room visit, that's higher than 180. For the systolic, and higher than 110 for the diastolic. Stages 2 and stages 4, or hypertension crisis, those are medical emergencies and the patients need to seek treatment immediately. Now, how do you remember this chart? If you remember that systolic is by 20 points and diastolic is by 10, then you should be okay. Okay, so we're going to demonstrate a blood pressure to the best of our ability without showing my student's face because she can't be seen per all the ISD rules. So just a few things before we get started. So in the PowerPoint, we talked about a sphygmomanometer. That's what this is. It says it on the dial. Can't miss it. This is how you are going to read your blood pressure. Now, if you have a manual cuff at home, it would be good for you to practice based on the instructions that I'm giving. And I will also find a video for you to watch that will show you a two-person interaction as well. Then you have your blood pressure cuff, which you're going to put at the where? what is that called? So right here, this is the antecubital fossa. The blood pressure cuff is going to go above the antecubital fossa, and it needs to be snug and fit. Also, when you're taking your blood pressure, there's generally going to be an arrow on, this is so weird when I'm trying to do stuff in the camera. There it is. So you're going to put this on whatever arm it says. This one is going to tell you, it says right arm, left arm. Most just have an arrow or a red dot, something signifying this is the side that you put on the arm. Okay, so you're going to help me put this on. So because this is my right arm, we're going to line this up to the right brachial artery. I'll take this off. This will go on last. You want to make sure that your bladder in the blood pressure cuff has no air in it, because it will defeat the purpose of you taking an accurate blood pressure. So again, make sure that that arrow and it is above the crease in the arm, essentially. Okay, so here's your pump. Righty-tighty, lefty-loosey. Righty-tighty, you're going to push the air in. When you come back, turn it to the left. That's going to deflate the bladder of the blood pressure cuff. Now, when you listen to a blood pressure, or when you listen for a blood pressure, you're listening for the first beat. That first beat that you hear, that is the systolic number, the top number. Then it's going to trail off, and the last beat that you hear is going to be the bottom number, the diastolic. You are not a robot, so it is not beep, it is beat. I just have to make that clarification, because if I put something on the exam for you to write it out, I do not want to see beep. We don't beep. So again, you're going to listen for the first heartbeat, or the first loved up. First sound that you hear is going to be the systolic number, the top number. The second, the last sound is the diastolic number. So what you'll do is you'll take the stethoscope, you'll take the diaphragm, make sure when you put it in your ears that it's on the correct side, because again, these do turn. Because if I turn it, now I can hear the bell. Turn it back, now I can hear the diaphragm. You'll take the blood pressure, you take the stethoscope, and you'll put it right on top of the brachial artery. Okay? And then now I'm only doing this because I'm showing you how to do blood pressure. But in reality, you would do this yourself. So we're going to pump it up. Here, hold this so they can see it. That way. Okay, yeah. We're going to pump it up, pump it up, pump it up, pump it up. Now you want to get up to about 160, 200, sometimes 160, 180. But you want to do it really, really fast, but consistent. So we let the air out very slow. I'm not listening to it, but she is. First beat. Last beat. Good. So we're going to do that again because she just practiced listening to the first beat and the last beat, but she can't tell me what my blood pressure is because she's showing y'all the dial. So we can't do that. But in overall, that is how you take a blood pressure. Make sure that the arrow is down towards the artery. You're going to put your stethoscope on top underneath the blood pressure cuff. You're listening for the first sound, which is the systolic. Then the last sound, the very last sound you hear, is the diastolic. And when you get those two numbers, then the top number is going to be the first one you heard. The bottom is going to be the last that you heard. Now it's going to take some practice with you getting used to doing that because it's a lot going on right here. You have to listen, watch this, calculate it. This is a lot. So it's going to take some practice in order for you to get acclimated to actually doing a blood pressure. Why do we have to know how to do a manual blood pressure? Any thoughts? Just in case the automatic one doesn't work. And if the automatic one keeps giving you an inaccurate read, which they tend to do, then you need to know how to take it manually. If you have, again, a blood pressure at home, I would advise you to practice on your family members, but if you do not, it's quite alright, but you do need to understand the steps on how it is done. So for individuals that have maybe a larger arm, they do have blood pressure cuffs that are for a large arm. This is a standard cuff. We also have pediatric cuffs. But it's okay. A pediatric cuff is probably about this big, and that's it. You would cut this off, and that's what a pediatric cuff would look like. You would have to take a manual cuff on a little baby or an infant or a toddler. Most of the time you just use an automatic for them, or sometimes it's just even waived. They don't even try to do it because they're just too flighty. But know that there are different sizes of your sphygmomanometer, your blood pressure cuff, in order for you to get an accurate read. Because if you put a small blood pressure cuff on a larger arm, it's going to read as if they have high blood pressure, and that's not necessarily true. It's the pressure of this cuff being too little, which is going to give you a false reading. When you are pumping and you hear the air coming out, that means that the bladder is not closed. So go ahead and push out all of the air that did escape into the bladder out, and make sure that you lock your gauge in order to have the bladder still up.